All right, everybody, it is 4 o'clock on Monday. Time for updates on what's going on in the state and our battle with COVID-19. Let me start because in the increase that we're seeing and the weeks that are likely ahead, we're going to need to hear and to know that we're going to get through this, and we're going to get through this together. If current trends continue, it will be a difficult fall and a difficult winter. But I believe that we have the opportunity to improve our situation. One of the big ways we do that is wearing a mask. So this is the Rise STEM Academy for Girls. We appreciate them making sure that they are looking out for all of their students for when they return to in-person class. They are not quite there yet. Let's start with our Fast Four at 4. Let's remember that as we deal with COVID-19, there are still so many other epidemics that we are dealing with here in the state, in this nation, and in this world. One is domestic violence. October is Domestic Violence Awareness Month, a time set aside to acknowledge domestic violence survivors and to be a voice for the victims. Domestic violence affects both men and women of every race, religion, culture, and status. And it's not just physical abuse. It's yelling, humiliation, stalking, manipulation, coercion, threats, and isolation. Domestic violence victimization leads to long-term and far-reaching health impacts and trauma. Children and youth who are exposed to domestic violence experience emotional, mental, and social damage that can and does affect their developmental growth. While Kentucky has made substantial progress in addressing domestic violence, Kentucky's rate is considerably higher than the national average, 45% compared to 37%. Kentucky State Police has employed 16 victim advocates, one for every KSP post, to provide support services and resources to crime victims across the Commonwealth. Advocates administer care to crime victims or those involved in traumatic events, connecting them with immediate resources such as mental health services, crisis intervention, or legal support. These skilled professionals also serve as liaisons between law enforcement and that victim, simultaneously helping the victim navigate the system while allowing detectives to focus more on the details of the case on that perpetrator. KSP is among the first state police agencies to implement this program on a statewide basis. If you or someone you know needs assistance through the KSP Victim Advocate Support Services program, please contact your local post and request to speak to the victim advocate. Since October 2018, the Kentucky Justice and Public Safety Cabinet has awarded $28.8 million to domestic violence agencies throughout the Commonwealth to provide services to victims of domestic violence. There are so many across the state that are working so hard to address and hopefully one day end this epidemic. Kentucky's domestic violence programs and shelters are open 24/7, even in the midst of COVID, to those who need it. COVID should not be a deterrent to individuals and families in crisis and in need of this support. Kentucky shelters never close during COVID, and I know they never will during any crisis because they know the important work that they do. Programs are using masks and practicing social distances while offering alternative shelter to those that need it. To get help or to help somebody else, call your local shelter hotline or the national hotline at 1-800-799-7233. Visit Kentucky Coalition Against Domestic Violence website, www.kcadv.org, for a list of numbers, resources, and tips. Every Kentuckian deserves to feel safe in their home while we fight for a better future. And I just end by noting that while it happens to individuals of both sexes and of all races, the level of violence against women in this state is absolutely unacceptable. It's something I fought against as Attorney General. It's something that as a son and a husband and as a dad, we just can't accept. We just cannot accept. Violence is never the answer. And there are so many out there that are dealing with violence in one of their relationships. Let's make sure we're there for them. Let's make sure we're watching. And let's make sure we pick up the phone when somebody needs our help. That's our job. All right, second, Connect. Today we made a really exciting announcement about the return of Connect, which is going to make a difference for families across the Commonwealth. This is a reconnection of the Connect portal, but this isn't the same Connect that the last Governor Beshear put into place. This one is significantly expanded, taking work and accomplishment by both the Steve Beshear administration and the Matt Bevitt administration to move us forward. I believe that health care is a basic human right, and every member of Team Kentucky, that's everybody out there in our state, ought to have affordable health coverage. The new Connect offers expanded benefits, ways to connect to the federal exchange. It will connect you to the state exchange next year when we start it. You can sign up for Medicaid, for K-CHIP. Let's make sure every child, especially those in poverty or close to poverty, has the health care coverage they need. You can get it on the Connect website. It's easy to use, and it's a way to connect you not only to health care coverage, but also food assistance, resources on foster care, on substance abuse, on so many different programs this Commonwealth has that we're bringing under one umbrella, so that just with a couple clicks, using your phone, you can get the help that you need. You can also track the progress of your application, know where it is through the process. It's going to be a really exciting tool. It is live now with so many different ways to get help. And it's going to take on even more of a role next year when we transition to a state-based exchange. I think that's January of 2022. That's going to save us about $15 million a year, which is going to be real helpful for the Commonwealth moving forward, but also I believe it will ultimately provide more options and more synergy when people transition from Medicaid to the exchange, ultimately, hopefully, to an employer insurance product. The original Connect site, it was something pretty special. Between it and expanded Medicaid, it helped sign up over 500,000 Kentuckians that had never had coverage before. We had the largest decrease in our unemployment rate in the country year after year after year. And I think that was a pretty special accomplishment. But I know we can do even better. We want kids and adults not only to be healthy and to be able to see a doctor, but for no one to ever go hungry. For people who need help from substance abuse to get that help. You know, in this pandemic, we've been really good about reaching out and providing that short-term help that people need to make it through this. Well, people go through personal crises too. They go through personal difficulty too. How about we keep that same compassion, but also have the tools ready to get people the help when they need it. The URL is connect.ky.gov. People who have bookmarked or who keyed in benefine.ky.gov will be directed to this new site. I think this is really exciting. I think it is going to make it so much easier to get the help that we need. I think it's going to make it seamless, and our goal is for it to operate as well as any app that might be out there that you regularly use. All right, number 3, vote. Voter registration deadline is today, and so I hope that everybody who was not registered got out there and did. Next, you have got to request your absentee ballot if you want to vote by mail. For concerns about the coronavirus or other reasons, you have to request it by October the 9th. That means you don't have that many more days. So you need to go online now, govoteky.com, and request it. If you are requesting it this week, I would suggest that you make plans to put it in a drop box instead of the mail. If you're going to mail it in and you've already gotten it, do it as early as possible. But you won't be able to get an absentee ballot after October the 9th with limited exceptions. So please get online and do it. I did it. My wife Brittany did it. So many others are doing it. It's very easy. Make sure you do it correctly. There are a number of steps in it. Get online and request that absentee ballot. Early in-person voting will begin on October the 13th. I think that's a week from Tuesday. And then it will go for 3 weeks until Election Day. Make your plan. Are you going to vote absentee? If you are you going to mail it, or are you going to put it in a drop box? Are you going to vote early? If so, what day are you going to go in those 3 weeks? And have you gotten online to check the locations in your county? Are you going to go on Election Day? And if you do, have you thought about the time to make sure that people are spread out about when to get in? Make sure you have made that plan. And we, in the governor's office and in the Department for Public Health, are working with the Board of Elections and the Secretary of State and trying to make sure it's safe. So today we are announcing that we're going to be providing PPE donations to us from our stockpile to assist with ensuring that we have safe elections in a time of COVID. We're going to be providing 46,000 gloves, 160,000 masks, 13,000 gallons of hand sanitizer, 28,000 face shields, and we are looking at a few other things that we can do to help. So vote. Bedrock principle of democracy. I mean, if people will stay up on Facebook all night long and argue, making a plan to vote isn't that hard. Get out there. This is how our voices are ultimately heard. I want to have a record turnout here in Kentucky, and if we do, we ought to make all these changes permanent. Let's have that record turnout. Okay, so each week we have done a Mask Up KY segment showing people doing the right things, but we this week start with Mask Up KY being the Team Kentucky competition. Every day we're going to choose 3 winners, and they are going to get one of these Team Kentucky masks, which we hope that they will wear proudly to continue to encourage people to do the right thing. And folks, where we are, with over 6,000 cases last week, we have to wear these. I mean, if we're concerned right now at some of our businesses being at 50% capacity, if we continue at the way we're moving on, we'll have 0% capacity because the virus will have spread that much to where you won't have customers and it'll be hard to keep your employees well. This is the way that we can do so many things. So let's celebrate the people doing it right. All right, first is the Daphne's Legacy Group, whose 5K was postponed to COVID, but they still came together to honor Daphne and raise awareness for breast cancer research. Made sure to mask up and social distance during the memorial walk. They're doing something special in a different way. And I know it had to be really hard on them not to be able to do the regular 5K, especially with the deep meaning that it has. But I think this is a great example of Team Kentucky doing the right thing, even when it's really hard, and sometimes really hard emotionally. So they're going to be our very first Team Kentucky winner. We're going to reach out and send a couple of masks. And if they have a Daphne's Legacy mask, I'm happy to wear that one day in her honor and to honor their good work. All right, second, this is one of our hard workers on the 2020 U.S. Census, which is coming to a close, but making sure that she stays safe while she is out there, making sure that we are all counted. Fill out your census. Fill out your census. Otherwise, we are going to lose dollars that will go somewhere else. You take any state that you think we have a big rivalry in, and whatever sport it is or anything else, they are going to take your money because that money's going out. They're going to take your money if you don't get online and fill out the census. Appreciate everything she's doing with the meeting. We're going to send one of our Team Kentucky masks her way as well. And then finally, this is pretty neat. These are some of our teachers masked up to ensure at Woodford County Schools that they get to see their students, but they do it in a safe way. We so appreciate every single one of our teachers. In fact, we want to make sure that we thank a teacher because I believe it is this week is a celebration of that. So ensure and make sure as your kid, if they are going in person, says thank you, let's say tomorrow and the next day. And, how about every day that isn't even one of these weeks? They already do such amazing work, and now they're having to do it in a difficult and dangerous time. Please show your appreciation. All right, let's talk first about last week. We cannot have repeats of last week. Last week was our single highest week in terms of positive cases. The week before had been the highest week, and we shattered that record. And look at this graph. I mean, we saw us going up from the 3,000 into the 4,000 mark, and we thought that was shocking. And we even got close to 5,000, and then last week, 6,126 cases. We are in an escalation. And today's numbers are higher than normal Monday's numbers. We are in an escalation. And what does an escalation do? It threatens the health of our friends and our neighbors. Thankfully, we are pushing down the mortality rate, but it's still appreciable. It's still significant. And whether it's now under 2%, whether it's even 1%, 1% of 6,126, 61 Kentuckians that we'd lose, I think we have to do better, and we can do better. While it has been a challenge, and when you look at just about any comparison across the country, Team Kentucky has done an incredible job. And whether it's our total number of cases, even when adjusted by population, when it's our deaths adjusted by population, especially considering our normal health outcomes, we have done a really good job. But this is really concerning. Increased cases lead to increased deaths. Those are people we love, and those are people that we don't want to lose. Learned about another friend who lost a great uncle, I think just today, to COVID. That's now, in the last 3 days, 3 people that I know that have lost someone close to them. That's where we're getting to where if you don't know someone that's lost someone to COVID, you're not listening, because it's that prevalent in where we are in the Commonwealth. And now's our test. Test of values, test of faith. Are we willing to live for other people? Wearing a mask is inconvenient at most. Are we willing to accept inconvenience to protect life, to protect our economy, and to get our kids in school? That's our choice. Or are we willing to say that we shouldn't have to go through any inconvenience, and because we don't see people suffering from COVID because they're either in their home or in the hospital, that we're not going to respond appropriately? We just saw the President of the United States get COVID and have to be treated by a team of doctors in a hospital. It's that serious. We've seen how quickly it could spread, even through a place that tests every day, which is the White House. We wish them a speedy recovery, but I think that scenario shows you how we got to be careful. So let's show the top 10 rules that we talk about. Number 1, wear the mask. Wear it for you, protect yourself. Wear it for your family. If you're going home to kids and you're not wearing a mask when you're out, you wouldn't do that with anything else that you could bring home to your kids. So don't test COVID. It can come for anybody. And it also protects the people around you. And if I'm working next to somebody every day and I'm not doing what it takes, I'm putting them at risk. I may be the governor, but I'm not willing to put anybody I work with in risk, because I'm no better than anybody else, and I owe them a duty for their safety. That's my job. Socially distance. Wearing a mask isn't enough. You also got to be 6 feet away from people. It is an and, not an or. You got to do both. Wash your hands and surfaces. Limit crowds and gatherings. Folks, it's not just college students that we see at parties. We know they're going on with adults too. And just look at that Rose Garden ceremony and you see what happens when people get together and don't follow those protocols. And remember, that's with everybody being tested. Nobody is testing everybody before they come to a barbecue in their backyard. So make sure you're limiting gatherings to 10 or less. Stay home if you're sick. If you have a runny nose, stay home. Got one of the folks that works closely with me, family member had a fever this morning. Don't think it's COVID. I'm pretty positive it's not, but guess what? That family member had a fever. She didn't come into work. That is the right thing to do. Everybody's got to do that. Get tested, answer the call, follow the guidelines, take care of yourself, and for God's sake, don't go to the beach during fall break when you want to keep your kids in school. We've already seen people die from other people's beach trips. Don't be that person. All right, today's update is one that for Monday is very concerning. Today we have 543 new positive cases of COVID-19. I believe that is the highest Monday, certainly in the last 4 weeks, and by an appreciable amount. That brings our total number of cases to 73,158. And you got to think about how fast that's increasing. Can you show the stepper chart again? We had 6,000 cases last week. It took us 2 months between the first case of COVID to reach 6,000 cases, and we did it in just a week last week. That's the escalation that we see. You say 543 isn't that much. Well, we used to have 300 on a Monday or below that. I mean, the days that we didn't break triple digits on a Monday weren't that long ago. Positivity rate 4.69% as of today. Again, it is creeping up closer to 5, though I do think it's down just a little bit from Saturday. It does say that we are testing a lot. That is a good sign at 1,539,707 tests. And in fact, I think we're climbing the rankings if they keep those in how we're getting people tested. That's a good sign, but our number of cases is not. New cases by county: Fayette 173, Jefferson Fayette includes about 130 of those are cases that in their terms were backlogged. They're trying to get caught up, so the state data is similar to what they can otherwise report. Every local health department has a duty to timely report the cases to the state. Jefferson 87, Davis 32, Henderson 18. Do we have today's incident map? Both Davis and Henderson, you can see, on this map. I don't believe Davis is in the red, but just south of Evansville, and what we're seeing is the counties in Indiana right above them are red too. Whitley 11, Kenton 10, Pike 10. The rest are all online, but what you'll see is that there are cases just about everywhere. We've also lost 5 additional Kentuckians that we're reporting today to bring our number to 1,214. And if we showed a stair-stepper chart like we do on cases of deaths, you'd see it trailing by 2 weeks or 3 weeks, but it looks about the same. More cases equal more death. If we are more casual as opposed to more urgent, we lose more of our family and friends. It's hard because you can't see it, but it happens. If we're not strong, other people typically pay for it. So let's be strong. Today's 5 include a 69-year-old man from Boyd County, an 85-year-old man from Davis County, a 99-year-old woman from Davis County, and a 91-year-old woman from Davis County, and a 71-year-old man from Robertson. To put today's 543 cases in context, it's more than last week's Monday report. And last week set our record by far. Last week we had 456 that we reported that day. After the audit, 448 compared to what we saw today. couple areas that we specifically report on: long-term care. Since the last update, 156 new residents, 117 new staff. That's a tough number. And 22 individuals that have passed away that we now know are attributable to long-term care. One of the reasons that we are seeing this is we have stepped up testing, especially for the staff, and we're paying for that. That's the way that you try to keep it from getting in a facility, is to do that staff testing. They are also going to have rapid testing now available for use on an almost daily basis. Unfortunately, this has also hit another one of our veteran centers, the Thompson Hood Veteran Center in Wilmore. We have 18 positive COVID veterans at that facility. 15 of 18 are on one unit. We also have 9 positive staff members, 4 of which have already been resolved. One of the COVID positive veterans has been resolved, and 5 have been transferred to the VA hospital in Lexington. We're following all of our protocols. We are watching this very carefully. But some of our veterans who fought for us, we're fighting for them. It's their doctors, but it's also every one of us wearing a mask and doing the right thing so that this does not get into those facilities. K through 12 schools, since Thursday, 157 new students have tested positive, 82 new faculty or staff. What we're seeing now is that the active cases are now a substantial portion of our total cases. We wish everybody a full recovery. And I'd mentioned the White House. Let me make sure I put the statement out. We also wish all of them and everyone who has COVID a full recovery. This is people's health. Politics shouldn't come into that. We hope everybody gets better. Colleges and universities, 194 new students, 1 new faculty or staff, 1 new university or college. Child care facilities, 12 new facilities with at least 1 positive, 10 new staff, 3 new children. All right, with that, I'm going to turn it over to Dr. Stack, and then we will come back and answer questions.
Thank you, Governor. Good afternoon, everyone. James, I'm sorry if I could have the first slide. Thanks. You've seen this already. The Governor's used this today. This is our stair-stepper slide, as we call it. He's already compellingly made the case and the points that I wanted to make from this. But if you look in the far left, those peaks are much lower. They're much smaller numbers. But that's what an exponential growth curve looks like at the far left. That's when you start the sharp uptick and you go up. Alarmingly, if you look at the far right now, we have the same pattern. Now, I've said this for weeks. This is scary because when we're this high, the numbers get bigger a lot faster. All right, so we are clearly now in an escalation. There is no doubt about it. And we are in an escalation where if it continues anywhere near this pace, we will go from 6,000 to 10,000 to 14,000 to 20,000. You go up real quick. This is exactly what happened in New York. This is what happened in Florida. This is what happened in Arizona and other Texas and Houston. So we are unfortunately now on an experiment here in the state of Kentucky to prove or disprove, in a manner of speaking, if our rural state will experience the same tragedies that have unfolded elsewhere. I think one of the tragedies that plays into this is something that is at least theoretically within our control if we choose different behaviors. If we can show the next slide, please. Again, the Governor's used these images already, but this is our incidence rate map. We have used this map to link to school opening and closing to in-person instruction. We use this as a decision tool for our overall assessment of the situation. This is very reliable because these are confirmed positive cases. These are deduplicated, meaning we determine the heat on this map based on unique people who become infected by COVID-19. So this adjusts for all those other challenges we have with test positivity and other metrics. where you can't perfectly align the numerator and denominator. This is only representative of the new people infected in a county on a 7-day rolling average. This is about as ugly as it has looked. I think it's probably one of the ugliest maps we've had to date. The alarming thing is that the path we're on, you're going to see more red counties over the next week, and more red counties means more counties in trouble. The cutoff to get to the red is 25 cases per, I believe 25 cases per 100,000 or more. There's a few counties on here who are close to 50. And so you start having areas that are not just in the red, they are already going well up beyond the red. If I could have the next slide, please. I've shown these graphs before. I'm going to compare the United States of America to the rest of the world. So I'm building up, obviously, to make some points here as we go along. Other democracies have figured this out. Tragically, the United States of America has not. Our nation, for its many wonderful attributes, unfortunately is a spectacular failure in this regard. Our results for this disease management are really embarrassing, quite frankly, and we should be humiliated as a country that we haven't been able to come together better to get this done well. This is the number of new cases per population in these countries. I have picked only third world countries you've never heard of before, like Canada, Germany, and New Zealand, okay? Impoverished, under-resourced nations like Canada, Germany, New Zealand. And if you look on here, it's not even close. We have 22,000 cases per million people in the United States. You go down to Canada and Germany. Now these are under-resourced and destitute nations, I know, but you go down there, they're at 4,000. We are 5.5 times worse on a population-adjusted metric for the number of cases we have in the United States of America. We got to get our act together, folks, as a country. This is not just Team Kentucky, but obviously Team Kentucky plays a role because now we're a leading contributor to our new cases. If I could have the next slide, please. This is death. And the small number of people actually compared to others somehow misunderstand this into fear-mongering, which is a tragic misrepresentation of what this is. This is the tragic loss of human life on a scale we've not seen from an infectious disease in this country in a very, very long time, maybe back to 1918. Now, if you look at this, this is deaths adjusted by population. Again, I have used these absolutely low-income countries of Canada, Germany, and New Zealand and to make the point that the United States here is number one, and we are number one in an absolutely saddening and tragic way. We are 3.5 times as high in terms of death per million people as Canada, 6.5 times as high as Germany, and for all intents and purposes, New Zealand apparently doesn't have deaths. We're, for all intents and purposes, 650 times worse than New Zealand. So, folks, logic, reason, science may not be persuasive to some. I'm going to try a different tack here in a minute when I get to my last two slides. But folks, we're not getting it done. We're not getting it done. And it is ours to get done if we make choices. These folks in free democracies have made the choices they needed to make to get things done. Folks, we got to do better. If we can have the next slide, please. The CDC at its best is a crown jewel for public health science in the world. This is one of the reasons we value it so much and we have to safeguard it throughout this pandemic response. This came out just today. It was embargoed until 1 o'clock, so we're talking about this just over 3 hours after I'm allowed to share it. In this population study, they found one 13-year-old staying at a family gathering managed to infect 11 other people, 11 people out of the 14 in that household. I want to make sure I get that right here as I say that. I think it was 12 people. Yeah, it was 12 people got infected out of the 14. So he infected 11 other people. Now, here's the conclusions from this morbidity mortality weekly report from today. First, Children and adolescents can serve as the source for COVID-19 outbreaks within families. Let me repeat that, because people have lived in this fantasy world that children and adolescents somehow don't spread disease. Children and adolescents can spread disease. Second, this study shows compellingly, their words are, provides evidence of the benefit of physical distancing as a mitigation strategy. None of the 6 family members, because there were 6 family members who visited 2 different occasions during their almost 3-week trip, none of those other 6 who wore masks at all times and or when they didn't wear masks were socially distanced. And I think that's the more correct way to say this. They were socially distanced outside, wore masks whenever they weren't. None of those other 6 people got sick. You gotta wear the masks and you gotta keep the distance, folks. You gotta, or it spreads. Here's another thing. I've said months ago, you can't test your way out of this problem. You cannot test your way out of this problem. They tested a bunch of these people, and notwithstanding that, they had people with negative tests who infected other people and then turned positive on a later test. Does that sound familiar? Does that sound like something we've heard in the news in the last few weeks? You can't test your way out of this problem. Tests are important. They're useful tools. They are not a solution or a panacea. People who get exposed to other people with COVID should quarantine for 14 days. Until we find other ways to change that, if you get exposed to someone with COVID-19, you should quarantine for 14 days or you could infect a lot of other people, folks. And their final thing here, SARS-CoV-2, that's the name of the virus, can spread efficiently during gatherings, especially with prolonged close contact, physical distancing, face mask, and hand hygiene reduce transmissions. Gatherings should be avoided when physical distancing and face mask use is not possible. Folks, that is from today, from the United States of America Centers for Disease Control. That's what they've said today in their MMWR. If I could have my, let me hold on, go back one, I'm sorry. Hold on, I think I'm missing a slide. So on this one, I want to just make one connection here. I have been apolitical throughout all of this, and I'm going to be apolitical now, but I'm going to use an image so many of you have seen. It's been a picture of the Rose Garden that's been shown in the last few days. A picture with people shoulder to shoulder, front to back, packed in just like we do at any other event any of us have gone to, a graduation, an indoor event at a gymnasium. None of us like that when you're all packed in sardines. We've seen a picture of the Rose Garden, people packed in close together, people not wearing masks, people in close proximity to themselves or to each other, and you've seen in newspapers, for those who have looked at these images that show the individuals who are infected and where they sat relative to each other. Folks, we're watching in real time this study at the head of the United States of America's national government. This study that was published today about a 13-year-old infecting 11 other people out of 14 in a household on a vacation, we are watching unfold from the Rose Garden of the White House, and you can read about it every day in the news, however you get your news, whether that's Twitter, other social media, newspapers, television. It's being covered around the United States. Folks, this disease spreads. It spreads rapidly. I wish everyone a full and speedy recovery. I shared in a Twitter account, though, this over the weekend. The statistics, though, show that the longer you play at this game, the longer you ignore the rules, you will get burned. At some point, you get burned. And so my concern, my caution to all of you is I'm not here to lecture folks. It doesn't work. The way our brains work, the way our decision-making works, we decide what we believe, and then we determine or find facts to support what we believe. We would like to believe that we are evidence-based and we objectively and dispassionately review the world around ourselves and reach informed conclusions. That is not the way we are wired. We determine what we believe and then we seek facts to support what we believe. That's been shown in social science and social economics over and over and over. Here's what I'm worried about, folks. We have decided how we will believe, and now we're behaving on that, and we're going to pay a steep price for that. So I'm not here to argue. I respect that folks will see the world differently. I really do. And I'm here to give everyone the best chance we can. I am very grateful that our governor has given me the opportunity to serve and has given me the latitude to speak the way I do and to convey things as I see beneficial, I hope, for the state. So thank you for that opportunity. But I want to tell you, I'm going to give you a little exercise here at the end, and I didn't warn the governor, so we'll see what he says about this. If my slide's in there. Can you show me the next slide? Yeah, there we go. Thanks. Now his mailroom is going to be upset with me. And I'm going to tell you why I'm doing this. And I'm going to, just like a magician, okay? A magician is the art of distracting people right before their eyes, okay? I'm gonna reveal my trick to you here, and I'm gonna ask you to play along. I get mail. I don't get as much as the governor does, but I get mail. And thank you to all the folks who send me the cards, the words of support, the words of encouragement. I appreciate that. But here's the thing I want to suggest. I think all of us want to be good people. I think most of us are good people. And I think we want to be heroes in our own story that we tell about ourselves. And I think folks who believe masking is good and people who believe it's bad somehow believe in their own minds that what they're doing is the right thing. I don't think people set out to become bad and evil folks. So here's a little activity I want to encourage you to do. I want you to ask yourself 2 questions. Why does COVID-19 concern me? And I'll tell you what, it concerns people, right? It concerns you because you're worried about your health. It could take someone's life. Or it concerns you because you're worried about your livelihood and your job. It concerns you because you're worried your kid won't be able to go to school. Everybody's concerned by COVID-19, all right? So why does COVID-19 concern me? And the second thing is, why am I concerned for my fellow Kentuckians? And I hope everyone has some concern for their fellow Kentuckians, because I think we do believe we're Team Kentucky. I think we get really proud of our state when our leading athletic teams win national competitions, when our state does well, when our bourbon is celebrated around the country, when our horses and our horse industry are celebrated. I think we are proud of Kentucky, and I think we care about each other. We just care about each other differently. So the second question is, why am I concerned for my fellow Kentuckians? Now, email doesn't count because it's too easy, and I don't respond to people on Twitter, so don't even bother with that. But if you want to take the time to make up a note card and send a note card to me, I'll look over those. I'll look over every one of them. And though I won't out you in public unless you tell me I can in that card, I'll take a look at that and I'll try to see how this narrative unfolds. And I want you to think as you do that. As you write about why you are concerned about fellow Kentuckians and why COVID concerns you, think about how others might answer that question. Because what I get in a lot of these cards is not that people don't respect our right to make choices. What I get is a lot of people who are scared for their life, their well-being, and for other people's lives and well-being. So I am quite comfortable. In fact, I celebrate supporting people's right to choose and make their own decisions. I have a harder time advocating for that when my right to make a choice for what I want to do commits someone else to possibly chronic illness or even death. I have a hard time with that. I've said that before earlier in this journey when I think we were closer in April sometime. Where do my rights to make my individual choices end when they compel someone else to accept a consequence they can't control? So folks, I think the vast majority of you really want to do what's right. And I hope some of you will go on this little journey and do this exercise and send me a note card and see, and I'll see what you say. And they'll all come here to the Capitol, and the governor's mail people will love me for it, and I'll take them back to my office another day. But folks, this is within our ability to impact. And I've said it repeatedly, the governor said, it's real simple. Wear a mask and stay away from folks. Keep some distance physically between yourselves, more than 6 feet. We got a long road ahead of ourselves. And if we don't pull it together soon, unfortunately in Kentucky, we're gonna feel the bite. Some of the hospitals will get full, a lot more people will pay with their life, and it just does not need to be that way. Please, don't be cavalier about this. This is not a drill, and we need everybody on board doing the right thing. Thank you.
We are lucky to have Dr. Steck. He is passionate. He cares about the state and our people. He is not afraid to give his medical advice. And I'm going to remember all that when I'm having to talk to the ambassador of Germany and Canada, probably here in the next several hours. Also, Steve, they're called national championships. Actually, can we learn that sign language real quick? That's something in Kentucky we all ought to know. National championships. There we go. I hope we can see that a little bit more. We'll open it up to questions. We'll start over here today. Joe?
The coronavirus last few days. What are your thoughts about his diagnosis, and how do you feel about the way he has handled his diagnosis since being tested positive?
Question is on the president's coming down with coronavirus and his actions since. First, I hope he, the First Lady, everybody else in and around the White House, everybody across America gets better. Right? We all ought to want each other to get better. And I'd say to anybody out there, if you're feeling differently about it, it's frustration, it's other emotions, let's get back to a place where we all want everybody to get better, and I want them to get better. I think there are some actions that set good examples and some that set bad examples that the president has engaged in. First, ultimately, he did make public his diagnosis, and I don't know the road to get there, but I believe that allowed people to see that anybody can get the virus. Second, he did go seek medical attention when he needed it, and that's a positive. We want people who need medical attention to get it. Now, there are some other areas where we need a better example from this president. First, I've been begging for months to have this president wear a mask in public. I sure hope that we will see that now every day, all the time, when he's not up speaking and can put it on and take it off. I mean, there are people that I believe that aren't wearing a mask in our country right now that will start if the president will, and that's a way to protect a lot of people out there. Second, he violated quarantine or isolation. You can't do that. I remember the day that I was showing what I thought were symptoms to COVID. I can tell you that those that are tasked with my security and my family's security, I didn't want them 20 feet from me. Wanted to make sure that I did not put them in harm's way. What they do every day for my family is something really special, and I don't think I could live with myself if I was cavalier with their safety in those instances. And then I have some concerns about whether or not the president is leaving the hospital too early for his own health. So there have been a couple of areas where I think that there's been a good example, but I think we need a better example.
Saying this for weeks, and things are getting worse. And so what else are you prepared to do to make a difference? And I should add, I was in a truck stop last week down in southern Kentucky where none of the employees were wearing masks. And when I asked why, they said, we don't have to.
Well, it's a good question. It's about, with cases increasing, what additional steps are we going to take? And a story about being at a South Central Kentucky gas station with none of the employees wearing masks at all. We're stepping up the enforcement starting today, certainly from the state side. Requesting a call with mayors and county judge executives. We need them to do it too. We need to make sure that everybody out there is getting back to the place where in your business you cannot check somebody out if they are not wearing a mask. Shouldn't matter who they are. This was requested by the Retail Federation. We got to make sure all of their, not only their employees, but their businesses are not checking people out without a mask. Grocery stores can't be doing that either. If we want to stop this escalation, we've seen how to do it before, but we actually have to do it, which is wearing the masks. And so certainly from the state side, and we're going to be pushing from localities, we very much need stronger enforcement. We shouldn't have to, People should be doing it for their values or for their faith, loving their neighbor as themselves, but if it is in our power to get better adherence, we're going to do it. Catherine?
President Trump. He tweeted earlier today that we should not be afraid of COVID. Don't let it dominate your life. I'd just like to hear your response to that specific statement.
Question is about the president's tweet where he says, don't be afraid of it, don't let it dominate your life. Second part of that sentence, I don't want it to dominate people's lives. That's part of our mental health that we talk about. You know, we're living through a pandemic, and so it's going to be a big part of our lives. But to stay healthy, we need to make sure that we don't let it dominate our lives. I get that. But no, we need to have a healthy fear of a pandemic that's killed 1,200 Kentuckians, 200,000 plus Americans. That's more than we lost in multiple wars. We have to have a healthy fear of a virus, and if we don't, other people pay the price. I don't know if it was an attempt to sound macho or what the impetus behind it was, but I mean, the president's surrounded by doctors and no one else is. So I hope we all have a healthy fear of a worldwide health pandemic that has killed so many people and is going to continue to kill people. Tom?
Governor, I'm sure you read about the Michigan Supreme Court decision regarding executive orders in states of emergency that they did on request of the federal courts. I take it this would be apples and oranges given the way Kentucky law is compared to Michigan law?
So the question is on a Michigan Supreme Court case that just struck down their measures to stop COVID-19. It is apples and oranges because we have both a constitutional difference from Michigan in when our legislature meets, and also I believe some of the things that are written in there about the powers of the governor. And then we also have a statutory scheme here that is very clear. You know, every state has their own constitution. And so you can't compare decisions that are made by one state Supreme Court with another the way you can, say, different federal circuits interpreting the U.S. Supreme Court. We believe that they are very different. I believe the Michigan legislature meets, if not regularly, multiple times every year, and that's very different than what we're seeing here. I believe that the law supports everything that we have done, and my belief is that the justices will see that law and follow it.
Governor, a few weeks ago I asked you if we were at the point of no longer teaching people and health departments start citing people. Are you at the same point with law enforcement and individuals?
The question is on a lot of health departments and others had been doing what they called education. So if you had a packed bar, instead of fining the bar for violating the rules and intentionally violating them, it was well, you know, you can only have 50% capacity and everybody's got to stay in their chair. And I guess the owner would say, oh, well, thanks for telling me. And then what we've seen is some of the same places packed again and packed again. Now, unfortunately, what we've seen is some others who are trying to do it right, see the people who are committing all the violations, nothing seems to happen to them, and they say, well, my business is struggling, I'm going to do that too. The challenge is people get hurt with that. I get everybody's bottom line, and I want everybody's small business to succeed, but not at the cost of people's health and lives, so we got to make sure that we're enforcing that. We need health departments fining businesses if they're not following it, and we need everybody, every government official, when they are seeing something that doesn't follow the rules and regulations, to do something about it. Nick?
What expects an action from you in terms of restaurant capacity, students back in school, any recommendations, any mandates, anything?
So in seeing our escalation, if we can't stop this escalation here in the next couple weeks when we're seeing it, because it does take a little time to do it, then the White House is going to recommend changes in capacity for various businesses, and we're going to have to take a very serious look at it. The schools are going to happen automatically. If we keep seeing the escalation, more counties in red, less kids getting in-person instruction. So we're going to be put in a position that we don't want to if we can't step up and do what it takes to get the numbers down. Oh, we'll have recommendations from our own folks too, but we've been through and seen when we're in the red in both increase in cases per 100,000 and increases in our positivity rate. when we hit red. And if the White House is recommending a capacity change and we think it's the right thing to do too, you got to move ahead and do it. So it's something that if we don't get this turned around, that we're going to have to very seriously consider. But we know how to stop it. We've done it before. It's as simple as wearing our masks, social distancing, and following the guidelines. We just need everybody doing it. All right, question from the governor's briefing regarding an incident that happened with a Bullock County school bus this morning. A parent posted a video on Facebook of a truck laying on its horn for the entire time the children were getting their sanitizer and temperature checks before getting on the bus. I just wondered if the governor had any message or response for this type of behavior as school districts work to ensure the safety of their students during the pandemic. What a jerk. Don't be this person. Nothing you're going to, no deadline is worth risking the safety of our kids who are getting on a bus. This pandemic, for the most part, has brought out the best of us, but it has exposed some people that need to open up their Bible, talk to their minister, and get their head right. Laying on a horn while kids are trying to be safe getting on a bus, that is not who we are as Kentuckians. That's not a part of Team Kentucky. I hope that person goes and talks to somebody, and I hope we all think about that before we either take an action like this or sometimes even sit at our keyboard.
Do you have any indication when the Kentucky Supreme Court's going to come back with a decision on
So the question is, do I have an indication on when the Supreme Court will come back with a decision on the Attorney General challenging not just everything we've put in place to protect people from COVID, but workers' compensation for our first responders and millions upon millions of dollars in school funding that we might even have to pull back if the Attorney General won his argument. We don't know. There is an injunction in place for any changes there's an injunction in place which keeps the orders in effect and protecting people. There are rendition dates that the Supreme Court publishes online about when their next set of decisions is going to come out. I haven't seen when October's is, and there's no guarantee that it's coming out in October. Sometimes they also do a special rendition too, which they put out like 12 hours or so before it comes. Debbie?
What means do you have to enforce the rules such as mask wearing and social distancing and capacity, and who's going to do it?
The question is, what means do we have of enforcement? We certainly have the labor cabinet. We have ABC when it comes to restaurants and bars. We have local health departments. And while I have seen some things floating around about we can't enforce this because it's an executive order, they have the force of law under Kentucky statute. So we're going to be talking to mayors and county judges, and after seeing this escalation, I hope they're on board too. I mean, we've got to stop where we're going. Otherwise, our economy is not going to recover, not because of any capacity issue, but because no one is going to go to a restaurant if we have continued escalation of COVID cases. It just won't be safe. Wondering what the governor and Dr. Stack's thoughts are of Ashland Independent Schools banning students from wearing gaiters to school. Those are the neck things as a facial covering. I believe the CDC has said those are the least effective facial covering, so I support that decision by Ashland Independent. There may be other schools that haven't made that decision depending on age of kids or wanting to make sure everybody wears something, but we want to support a decision of our public school system, especially if they think they're providing more protection. Tom?
You and the Secretary of State and the Board of Elections have all agreed on your emergency regulation for November. Do we have enough polling places, you believe?
Question is on this election that's coming up. Remember, more ways to vote than ever before. I want to thank Secretary Adams for, with me, reaching a bipartisan agreement, but he also put together a real good proposal before I ever saw it. That's bringing out our best in the midst of a pandemic and pushing out the politics, and we should really see more of that. Also, the Board of Elections, Jared Deering and others for their good work in it. We see each county plan, and I believe given we're in a health pandemic, most all of them have enough polling places. Everything that I've seen has 10% or more of the regular polling places spread out. around a county. I know that they are looking at Fayette. I think Jefferson, where I think they're still talking about maybe a couple of final changes, but overall, when you look at a map, it looks like there's a lot of opportunity in a lot of different places. What we also look for in counties that big is how many early voting places there are and how they're staying open. But by and large, I think people are submitting really good plans. Sometimes you have to ask, for some of the reasoning. The precincts don't always line up with the number of polling locations regularly either, so you gotta get into the data a little bit. Why are some of the least populated counties in Kentucky reporting some of the highest rates of the virus? Well, it's because it's everywhere. And sometimes it's an area that hasn't had a lot of testing, and once it starts, you realize how much of the virus there is, but it also grows. And there are some places that I think have been more lax on wearing a mask because they believe there hasn't been as much virus where they are. This is everywhere throughout our country and throughout the world. The countries that have a lower amount are ones that continue to use good practices, and we need to too. But it can happen very quickly. And remember, most of the time when we get a positive test, it's days or a week behind the activity that led to it.
That this would lead to a national mask mandate?
Based on what I've seen in D.C., do I think it will lead to a national mask mandate? I do not anticipate that we will see a national mask mandate. I think we should have one. I think it would save a lot of people's lives. I think we could open up more capacity in all of our business if we were doing this as a country. I mean, if you look at our incident rate map, over half of our counties that are in the red are on the Tennessee border. 3 more of them, are right there in that Evansville area. I mean, if everybody in all the states around us and in everywhere our people go on vacation were wearing a mask across this country, we would be in a much, much better place. So I hope that we will see it, and I hope that we will see examples from everybody that push us to do the right things. So folks, we've been saying we're worried. We've been saying that we think we're in a dangerous place. Last week ought to show everybody that. We're not trying to win a game. We're trying to survive the pandemic of our lifetime. And sure, most of you that are watching, you're going to survive it. Most everybody's going to survive it. But what about those that don't? We've already lost more Kentuckians to COVID than we did in either the Vietnam or the Korean War. Isn't that enough? And these are Kentuckians. They are Americans. They're people we care about. They're not nameless, faceless individuals. They are not a county and an age. They are people who are loved. Let's make sure we're showing that love too. Whatever your reason is to follow the guidelines and do the right thing, grab a hold of it. Make sure you can hold on to it for however many months this takes until the vaccine is out, until we know it's safe and effective and it's distributed. Whatever it is that drives you to do the right thing for people. Dig down and find the reason that before you may have volunteered or you continue to volunteer for a good charity. Maybe about the reason that you hold some real strong political view that you think are really important to people. I'm sure there's something in your heart that cares about other people. Right now, we need your heart to grab a hold of one of these, because that's the way you're going to help care about people over these next months. We're going to get through it. We're going to get through it together. To do so means we're going to have to work a little bit harder. We'll see you tomorrow at 4.